just so you know, everyone, we're always recorded anyway, so this is not new.
Okay, so I'm recording to the cloud. Let's hope this works. Okay. Yeah, okay, I think everybody's ready to go. Okay, well, welcome everyone. My name is Leo Hercha, and tonight's lesson is going to be about the blood system. So chapter 13 in your textbook, feel free to follow along. Take some notes if you want to, but again, the slides will be posted on the Moodle after tonight's lesson. So you always have that to refer back to. So I'm just going to go ahead and share my screen with you guys. Hopefully this works seamlessly. Let's see. Everybody can see my screen? Yes? Yeah. Perfect. Okay. Does anybody remember Seinfeld? Please say yes. I'm dating myself here. Does everybody remember Seinfeld? Like Seinfeld? Okay, well, anyway, I found a cute little clip that I thought I'd start the lesson off with that talks about Kramer's blood bank issue, and I thought it'd be kind of fun to start it with. So let's take a look.
Hey, what are you doing here? I thought you were supposed to be babysitting amphibians.
There was an incident.
Oh, no. Where's the blood? It's in here, isn't it?
You stop it.
What is this?
It's Jell-O.
This is blood, isn't it?
This is tomato juice. Look.
Oh, you're sick! You're sick!
Will you calm down? I took all my blood down to Newman's. He let me put it in his meat freezer.
Hey, what's going on? Who made pudding?
Oh, yeah, George. He came by and made some more of those pudding skin singles. They're the big shits.
George, I told him I didn't want this stuff around.
Hands up!
Ah,
It's okay. I'm right here.
I can see that. What happened?
That knife, it nicked your jugular. You know, Jerry, when somebody yells heads up, you're not supposed to actually look up. I don't remember that. Anyway, you're lucky I was there. You lost a lot of blood. You got 3 pints of Kramer in you, buddy.
So classic. They just don't make shows like that anymore. Okay. All right, so let's move on. Okay, so today's objectives, goals. Identify terms relating to the composition, formation, and function of blood. Differentiate. Sorry, nerves are getting the best of me. Differentiate among the 4 major blood types and different blood groups. Identify terms related to blood clotting. Describe various pathologic conditions affecting blood. And describe various laboratory tests and clinical procedures used with hematologic disorders. So let me see if I can just make this a little bigger so you guys can see it better. Can everybody see? Yes, everyone's good?
Yes.
Okay. So first of all, before I go back to that slide, what do you think the role of our blood has in our system? Anybody have any idea of what the blood does in our bodies?
Carrying oxygen to each part of the body.
Yeah, carrying oxygen, absolutely. Anything else?
Is to maintain a constant environment for other living tissues of the body.
Right. Oh, very good. Does anybody know their blood type?
Yes.
Yeah?
I am A positive.
You're an A positive?
Yeah.
Okay. Anyone else know their blood type?
I'm AB. AB.
Okay. Why would you think it's important to know your blood type?
For example, for your blood transfusion thing.
Yeah, if you're in the hospital and you needed a blood transfusion, something along those lines. Yeah, very good. Okay, so we just discussed a few things, but the main role of our blood, it's a transportation device for nutrients, Let me just move you over here so I can read my screen. Nutrients, gases, and wastes to and from the cells of the body. Oops, hold on. Okay, so our cells, they're 45% blood of our blood volume. They consist of erythrocyte, leukocytes, platelets, or thrombocytes. So an erythrocyte is a blood cell that contains a pigment and color, otherwise known as the red blood cell. This cell matures from an erythroblast to an erythrocyte. And it actually loses its nucleus, or the nucleus of it, and assumes a shape of a bioconcave disc. And its role is to transport oxygen and carbon dioxide to and from the tissues. That's what our red blood cells do. Leukocytes are a colorless cell that circulate the blood, in the blood and the body fluids, and is involved in getting rid of foreign substances and disease, otherwise known as the white blood cell, right? It plays an important role in the immune response that protects the body against infection. So platelets and thrombocytes next, they help with blood clotting. So when our bodies have an injured blood vessel and needing clotting, it sends a signal to those receptors, and the platelets go to that area and actually create a clot. It's kind of interesting, isn't it? Then if we move into plasma, so plasma, it's that yellowish liquid that is part of the blood, and it carries cells that make up 55% of the blood's total volume. The contents of a plasma is water, dissolved proteins, sugar, waste, salts, hormones, and other substances. So I believe that if you wanted to follow along, the plasma proteins are broken down on page 509. I believe it's 509. Are you seeing plasma on 509? My textbook is a 9th edition, so it's a little bit later version than yours.
Yeah, they have a blood, cytoplasma.
Okay, good. Yeah, perfect. Perfect. Okay, so plasma proteins consist of albumin, which helps maintain the proper portion and concentration of water in the blood. We've got our globulins, which are classified as alpha, beta, and gamma. And the gamma globulins are immunoglobulins, which are antibodies that bind and sometimes can destroy antigens and or foreign substances. So these are also distinguished by those letter formalities. So the IgG, the IgA, IgM, IgD, and IgE. So you can, we'll get, everything comes together once I explain it a little bit better with the schematic diagram. But then you have your fibrinogen, which is, it helps in clotting. It's responsible for occluding the blood vessels and creating that fibrin clot. And prothrombin. So prothrombin is also part of the clotting process, but it's vitamin K dependent. So let's go back to the white blood cell for just a minute. Oops, sorry. Getting ahead of myself. The white blood cell is composed of basophils, eosinophils, neutrophils, monocytes, and lymphocytes. So going back up to the top with the basophils, they contain heparin, so that prevents the clotting, and histamine involves in allergic responses. Eosinophils are a phagocytic cell, and phagocytic actually means to protect the body, and it's involved in allergic responses and parasitic infections. Neutrophils are also a phagocytic cell that accumulates at the site of the infection. Monocytes are phagocytic cells that become a microphage, so they're little attackers that digest bacteria and tissue and debris. Lymphocytes, they control the immune response and make antibodies to antigens. Any questions so far? No? So some diseases of the white blood cells, leukemia, which is an increased in cancerous white blood cells, which is acute myeloid leukemia or AML, acute lymphoid leukemia, ALL, chronic myeloid leukemia, CML, and chronic lymphoid leukemia, which is CLL. So this little schematic diagram sort of talks about, oops, blood clotting. I'm not doing too good with my moving around of my view here. Okay, so if we are to look at blood clotting, coagulation or the fibrin clot, and anticoagulant. So we're looking at heparin, warfarin, Coumadin. Anybody know what those medications are for? Who they'd be prescribed to?
Is it blood thinner?
Right, yeah, they're blood thinners. Yeah, exactly. So for a patient that's high risk for heart attacks, stroke, things like that, your doctor would be prescribing those types of anticoagulants for just that factor. So if you look at the little diagram here, we've got our injured blood vessels. So our platelets go to work. They get the signal in combination with tissues and proteins and clotting factors, calcium, vitamin K, prothrombin, and thrombin, and they change into that fibrinogen fibrin clot. Does that make sense? Okay. Some disorders of blood clotting. Hemophilia. Everybody knows what hemophilia is, right? Basically, somebody that's a bleeder. Excessive bleeding caused by hereditary factors of 8 and 9. Necessity for blood clotting. Patients often bleed into weight-bearing joints, especially the ankles and the knees. And purpura, multiple pinpoint hemorrhages and accumulation of blood under the skin. So I think Patty was making reference to this when she was mentioning that, you know, back in school days when her and I were in school, we would suck on our arms to give it like a hickey type thing, and all of a sudden we get this sort of hemorrhage, pinpoint hemorrhages under the skin. That's what it looks like. So here's that schematic diagram I was telling you about. It makes it a little bit easier to understand. Let me just try and move you guys away from this so I can actually minimize you. Different view here. Okay, that's better. Okay, so the blood right at the top, and I believe this is on page 509, so you can have it to look at later, but we've got our cells, which are part of the makeup, which is your erythrocytes, your thrombocytes and platelets, and then your leukocytes, which are your white blood cells, made up of your neutrophils, eosinophils, basophils, monocytes, and lymphocytes. And then we also have our plasma, which is made up of the water, salts, nutrients, hormones, and vitamins. And then we've got our proteins, which come down to albumin, globulins, fibrinogen, and prothrombin. And those globulins, as I mentioned, turn into those immunoglobulins and or antibodies. Does that make more sense once you see it in sort of that picture format? Yeah, it kind of breaks it down, makes it fit nicely, and sort of understand the complexity of it. Good. Any questions on that?
No.
All right, small little quiz I've got. Whoops, is this the first one? Yeah. Okay. The blood contains which of the following to transport oxygen? A, white blood cells, B, plasma, C, platelets, or D, red blood cells?
D.
Yeah, D.
D.
D, yes. Very good. Correct.
Blood cells.
Very good. And second question. Blood contains which clotting cells? A, erythrocytes, B, plasma, C, thrombocytes, or D, leukocytes?
Thrombocytes.
Thrombocytes.
C.
Remember the clotting. So
Thrombocytes.
Thrombocytes.
C.
D,
So-
leukocytes?
So if we look
D.
back,
Leukocyte?
if we look back to our little diagram here, what creates that clotting factor, that fibrinogen that turns into that fibrin clot?
Leukocytes.
Plasma.
Plasma. Very good. Perfect. Okay, so let's talk about our blood types. I know some of you said you knew your blood type, some don't, but it's actually quite important that we know our blood types. Personally, I don't even know mine, and when I put all together this lesson, I kind of realized that, wow, it's actually pretty important you know your blood type. So I think I'm going to be getting on that. So it's actually quite complex. So I'll go through this slide with you, but I also have a small video to show you that's quite interesting, and it goes through the whole complexity of it, gets really in depth about the different blood types and why it's important to have them for medical reasons or to know them, and what can happen if it's done wrong or someone's made a mistake. So type A is an A antigen and an anti-B antibody. Type B is a B antigen and an anti-A antibody. Type AB is A and B antigens and no antibodies. So again, universal recipient, somebody can receive universally. Type O is no A or B antigens and both anti-A and anti-B antibodies. So universal donor. And then of course we have our Rh factor, positive and negative. I know it sounds confusing, but I'm gonna show you this small little video. It's about 4 minutes. It's not too small, but it's quite interesting how it all works. So let's see if this works. Everybody can see this okay? Yeah, okay, here we go.
It's often said that despite humanity's many conflicts, we all bleed the same blood. It's a nice thought, but not quite accurate. In fact, our blood comes in a few different varieties. Our red blood cells contain a protein called hemoglobin that binds to oxygen, allowing the cells to transport it throughout the body. But they also have another kind of complex protein on the outside of the cell membrane. These proteins, known as antigens, communicate with white blood cells, immune cells that protect against infection. Antigens serve as identifying markers, allowing the immune system to recognize your body's own cells without attacking them as foreign bodies. The two main kinds of antigens, A and B, determine your blood type. But how do we get 4 blood types from only 2 antigens? Well, the antigens are coded for by 3 different alleles, varieties of a particular gene. While the A and B alleles code for A and B antigens, the O allele codes for neither. And because we inherit 1 copy of each gene from each parent, every individual has 2 alleles determining blood type. When these happen to be different, one overrides the other, depending on their relative dominance. For blood types, the A and B alleles are both dominant, while O is recessive. So A and A gives you type A blood, while B and B gives you type B. If you inherit one of each, the resulting co-dominance will produce both A and B antigens, which is type AB. The O allele is recessive, so either of the others will override it when they're paired, resulting in either type A or type B. But if you happen to inherit 2 O's, instructions will be expressed that make blood cells without the A or the B antigen. Because of these interactions, knowing both parents' blood types lets us predict the relative probability of their children's blood types. Why do blood types matter? For blood transfusions, finding the correct one is a matter of life and death. If someone with type A blood is given type B blood, or vice versa, their antibodies will reject the foreign antigens and attack them, potentially causing the transfused blood to clot. But because people with type AB blood produce both A and B antigens, they don't make antibodies against them, so they will recognize either as safe, making them universal recipients. On the other hand, people with blood type O do not produce either antigen, which makes them universal donors, but will cause their immune system to make antibodies that reject any other blood type. Unfortunately, matching donors and recipients is a bit more complicated due to additional antigen systems, particularly Rh factor, named after the rhesus monkeys in which it was first isolated. Rh plus or Rh minus refers to the presence or absence of the D antigen of the Rh blood group system. And in addition to impeding some blood transfusions, it can cause severe complications in pregnancy. If an Rh negative mother is carrying an Rh positive child, her body will produce Rh antibodies that may cross the placenta and attack the fetus, a condition known as hemolytic disease of the newborn. Some cultures believe blood type to be associated with personality, though this is not supported by science. And though the proportions of different blood types vary between human populations, scientists aren't sure why they evolved, perhaps as protection against blood-borne diseases, or due to random genetic drift. Finally, different species have different sets of antigens. In fact, the 4 main blood types shared by us apes seem paltry in comparison to the 13 types found in dogs.
Isn't that interesting? 13 blood types in dogs. That's complicated. Okay, are you ready for another small quiz? Let's see. It's a little quiz. Okay, let me move you so I can read this. There we go. Which is produced by your, can you see it okay?
Yes.
Yeah.
Okay. Which is produced by your body in response to foreign antigens, such as the wrong blood type. So would it be A, antigens,
clotting factors,
clotting factor, antibodies? What's the answer?
letter C.
Okay, anybody else?
Letter D.
Antibodies, exactly.
Antigen antibodies.
Right, right. Oops. Okay. And this last question. So Tyler has blood type AB positive. He can donate blood to a person that has blood type
AB.
AB positive. That's right. Good job, guys. Okay. Moving on, small activity we're going to do. I'm going to break you out into breakout rooms quickly. Just random, just going to hit the breakout room button, see what it does. And I'm going to get you to do a little bit of research for about 6 minutes. So your group, as you can see here, group 1 would be aplastic anemia. We're going to look at different types of conditions that affect the blood. The next group is going to look at hemolytic anemia, pernicious anemia, sickle cell anemia, and thalassemia. Okay, so I don't know what groups. Group 1, you've got aplastic anemia, so just write down on a piece of paper which group, so when you go into your groups, you know exactly what your topic is. So tell me what it is, how it affects the blood, how it affects the body, and what kind of treatments are out there? What kind of treatment options do patients have? So 6 minutes in your breakout room with your groups. Then we'll come back, we'll do a small discussion, about 2 minutes per group, so 10 minutes in total. And then we'll have a small little break for 5 minutes, stretch our legs and get a drink of water, whatever. Any questions on the activity?
Thank you.
You're good?
No.
Okay, let me, whoops, sorry, my computer is, all right. Having issues here, Patty. It's okay. Okay, so breakout rooms, where am I finding breakout rooms?
Right at the very bottom, it should be.
I've got, oh, breakout rooms, perfect. Okay, it's in a different format when I'm in a bigger screen. So we're gonna do 5 rooms, automatic, and I think go. Then all I do is press go. Open all rooms. Okay. This is really neat.
Leo, you got a couple people not in rooms here.
What do I have to do here?
Go to the breakout room thing and slide them into the rooms.
Okay, move to, okay, so which one? Oh, joined, the ones that are joined? No.
No, just like you'll see people at the top that say like not in rooms, because Gigi and Sarabjit are not in rooms.
Oh, geez. Okay. So at the top, I have breakout room 1. I've got 1, 2, breakout 2. Oh, not joined. Okay. Oh,
You see?
now it says joined.
And Sarabjit is the only other one.
Okay, let me move down here. Breakout room 3, breakout room 4. Okay, breakout room 4. Oh, come on. I can't seem to move down.
Sarabjit's name and put Sarabjit in the room. Yeah.
Which one is she under? Does it say?
Sarabjit. She should just be not in a room.
Huh. Because I got breakout room 1, 2, 3. Hold on. Oh, here we go. Not joined. I'm going to move her to breakout room 5. Oh, no. 1, 2, 3. How come it doesn't give me the option for 5, only to 4?
Just whatever. Just give her that choice then.
I'll just give her 4.
Yeah.
Okay. Yeah. Sorry, she's in now.
But she's not. But maybe she's not at her desk for some reason. Nope, she's gone. Good.
Okay.
Now it's just you and I. Yep.
Okay. Well, that was my first time doing that. Okay.
You can pause the recording for a few minutes if you wish, and then put it back, but that's up to you. Oh, Sarabjit's back. See?
Oh, okay. Yeah, I see her. Assigned to. Let me just take a look.
This may not be at her desk.
I'm just going to put her in breakout room 5 where she was initially put, and then we'll just see. And then I'll just.
Yeah. There, she's gone again. But if she's not at her desk, she's going to pop back.
Right. Okay. That makes sense. I understand that now.
Stephanie said she was going to be away for 45 minutes. So I don't know if she's back or not. She might be back.
Okay. How do I stop the recording for now?
Well, up in the top left,
okay.
You see it recording? You
Stop
should
recording. I'll just pause the recording.
Good. You're recording again.
Yep. I just resumed recording, I think.
Yep.
Yeah.
You did.
Good to go.
Okay. I'll mute myself.
So it's this little window I'm having challenges with. Show thumbnails. Okay, thumbnail video. All right. So 16, okay. Okay, starting to see people coming back. That's great. Means it worked. Okay, everybody can unmute themselves. Okay, let's see. How many people have we got? Have we got everybody back yet? Okay. All right, so do we have group 1 back?
Yes.
We have group 1 back? Correct. Okay, so group 1, aplastic anemia. What did you research out on that?
For me,
bone marrow disease.
Okay.
It's a condition that occurs when your body stops producing enough new blood cells.
Very good. Okay. And what treatment, is there treatment? How do physicians treat these patients? What happens?
The treatments would be blood transfusion or stem cell transplant, also known as bone marrow.
Very good. Okay, anything else for group 1, aplastic anemia?
The symptoms, aplastic anemia can have no symptoms, but when it's present, the signs are fatigue, shortness of breath, rapid irregular heart rate, dizziness, headache, fever, like prolonged bleeding from cuts, and also like nosebleeds and bleeding gums.
Yeah, right. Absolutely. Good job, guys. Anything else to add to that, or can we move on to group 2? I think that's really good. Answers all the questions. Okay, group 2, hemolytic anemia. What have we got for that?
Hi, for the hemolytic anemia, Sophie will do the cause.
Should I start with the causes?
Yes, please. Thank you.
Yeah, okay. So there are two main types of hemolytic anemia. It can be inherited and acquired. With inherited type, parents can pass the genes for the condition onto their children. Two common causes of this type of anemia are sickle cell anemia and thalassemia. While on the acquired hemolytic anemia, you are not born with it, but you develop it later on. Your body makes normal red blood cells, but they are later destroyed. This may happen because of certain infections, and you can get this from certain medicines such as penicillin, and the most common one is acetaminophen.
Acetaminophen, yeah.
And some types of acquired hemolytic anemia are short-term, so temporary, and it goes away. But other types can become lifelong.
Interesting. Good job.
For the treatment, the goals for treatment is to reduce and to stop the destruction of red blood cells and increase the red blood cell count and treating the underlying cause of the condition. And the treatment would be blood transfusion, medicines, plasmapheresis, surgery, blood marrow and stem cell transplant, and lifestyle changes as well.
Great.
For the,
yeah, that
sorry.
good. Go ahead.
Yes, and then for the other part of our research, we will have Gigi and Cedric.
Okay, perfect.
Yeah, the causes, the symptoms, these symptoms: paleness of the skin, fatigue, fever, confusion, lightheadedness, and dizziness. Other common signs are dark urine, yellowing of the skin, and whites of the eyes, like jaundice, heart murmur, increased heart rate. Yeah, that's it.
Hey, good job. Yeah.
Since hemolytic anemia is a blood disorder that occurs when your red blood cells are destroyed faster than they can be replaced, it can lead to many other diseases. For example, thalassemia. Thalassemia are inherited blood disorders, means that the disorder is passed from parents to children through genes. Thalassemias cause the body to make fewer healthy red blood cells and less hemoglobin than normal. Hemoglobin is an iron-rich protein in red blood cells. It carries oxygen to all parts of the body. Just that.
Perfect.
One of the diseases.
Perfect. Yeah, good job. Are you guys, group 2, all finished?
Yes,
yeah?
Thank you.
Okay, fabulous. Okay, group 3, pernicious anemia. What did you find?
Pernicious anemia is the lack of mature erythrocytes caused by inability to absorb vitamin B12 into the bloodstream. And the body can't absorb the vitamin into the bloodstream because without the aid of a special substance called intrinsic factor, which is normally found in the gastric juice, the vitamin can't be absorbed, even though, like, if the person eats like regular food like eggs or sardines, they can't absorb it.
So for the symptoms, it's like nausea and vomiting, confusion, constipation, loss of appetite, and heartburn.
Yeah, and treatments include like through shots of vitamin B or oral administration of vitamin B12 specifically. But yeah, if there's a lack of intrinsic factor in the body, that's usually the cause of not being able to absorb the vitamin B.
Right. Yeah. Okay. Good job, guys. Are we on to group 4 already? Sickle cell anemia. Who's group 4?
Sickle cell anemia it is a hereditary disorder of abnormal hemoglobin producing sickle-shaped erythrocyte and hemolysis. The cause of this is an abnormal type of hemoglobin in the red cell. The distorted, fragile erythrocyte cannot pass through to the small blood vessels normally, so it leads to thrombosis and infarction. The signs and symptoms are arthralgia, acute attack of abdominal pain, and ulceration of the extremities. The genetic defect is particularly prevalent among the people of African or Hispanic ancestry and appears with different degrees of severity. A person with a sickle cell trait inherits just one gene for the disorder and usually do not have any symptoms. And treatment for the sickle cell anemia, treatment might be include the oxygen, pain relievers, oral and intravenous fluids to reduce pain and prevent complication. Doctors might also recommend blood transfusion, folic acid supplements, and antibiotics. And one of the cancer drug called hydroxyurea is also used to treat the sickle cell's anemia.
Hey, good job.
Thank you.
And last group, group 5, thalassemia. What did we find with that one?
Yeah, thalassemia is an inherited blood disorder in which the body makes an abnormal form of hemoglobin. Hemoglobin is a protein molecule in red blood cells that carries oxygen. The disorder results in excessive destruction of red blood cells, which leads to anemia. Thalassemia is inherited, meaning at least one of your parents must be a carrier of the disorder. Is caused by either a genetic mutation or a detection of certain key gene fragments. The symptoms include bone deformalities, dark urine, delayed growth and development, excessive tiredness and fatigue, yellow or pale skin. Yeah.
Some of the treatments include blood transfusions, bone marrow transplants, medications, and supplements, or possible surgery to move the spleen or gallbladder.
Yeah, wow. Anything else with group 5, or is that pretty much it? Good job, guys. So as you can see, the blood system is quite complex, hey? Like it's, all the systems can be affected. There's so many diseases that things can cause if things are out of whack with the blood. It's quite an impressive system when you think about it in the bigger picture, hey? Okay, so good job. Let's take a 5-minute break just to stretch our legs and get some water. And what time is it? 7:26. So let's say 7:31. We'll be back.
Okay, thank you.
Okay, see you in a bit.
You can hit pause on recording again if you want.
Yeah, I'm trying to move my little banner here. This is a pain in the butto. Pause, resume recording. Okay. I think we're all back. Are we all back?
Yes.
All right. So we don't have much more to go here. We're going to touch on laboratory testing and some clinical procedures. So I believe laboratory testing is on page 522, 523 of your text. It's actually the same on mine. So some tests that you should be familiar with. So we will start with the antiglobulin test, or Coombs test, which is the test for presence of antibodies that coat and damage the red blood cell. Bleeding time. Anybody have an idea what bleeding time test would do? No. So bleeding time test determines how quickly your blood stops flowing just from a tiny puncture wound. So it's not necessarily, you know, the clotting factor, it's just how does it slow down with a tiny puncture wound and it stops flowing. Coagulation time. Now that's where they take a test tube and they calculate how much time it takes to clot in the test tube itself. Complete blood count, or the CBC. That test is used to evaluate over your overall health, and detect a wide range of disorders, including anemia, infection, and leukemia. The CBC test measures several components and features of your blood, including red blood cells, which carry oxygen. So it's quite important. And I think, you know, if you've gone for blood tests, I'm sure everybody has, that CBC is quite a routine test that the doctors use. The next one is the hematocrit test, the HCT test. So hematocrit, it's the percentage of red blood cells in total blood volume. The blood is spun in a centrifuge, and so the red blood cells, they fall to the bottom, and what do you think would float to the top?
Plasma.
Yes, good job, yay, plasma, that's exactly right. So the plasma goes to the top, red blood cells float to the bottom, and then they can get a really direct idea of how much red blood cells are in your system or in your blood. The hemoglobin test, so your HHG, HGB measures how much hemoglobin your red blood cells contain. And so your HGB is a protein produced by your bone marrow that's stored in the red blood cells, and it helps them transport oxygen to the lungs and through your body and your arteries. Next one is red blood cell. Where are we at? No. Did I miss one? I did. I missed one. Did I miss one? No.
You're on the partial thromboplastin.
I'm on partial thromboplastin time. Yes, PTT. So how long does it take you to clot? So this is one of those tests where they will determine how long it takes you to actually clot, not in a test tube, but actually on your body. Platelet count determines the number of platelets in your sample of blood. So when there's an injury to the blood vessel or tissues and bleeding begins, your platelets help stop that bleeding. I think, Charmaine, you got that question right on the test, didn't you? Platelets. Or, yeah, your platelet count. Okay, red blood cell count, RBCs, that's the next one. So how many, so your red blood cell count, your RBC, is how many red blood cells you have per cubic millimeter. And that's important because it carries oxygen to all the cells. So they want to just measure how many you have. Red blood cell morphology, it's a blood smear examination, and it compares the white blood cell size, shape, and general appearance to the established appearance of normal cells. So it evaluates the color, the size, the shape, indicators of hemoglobin content, and the RBCs themselves, and it estimates a number of platelets present. So it's quite a mouthful, that one, but yeah, I don't think I've ever had that test done. White blood cell count, or the WBC, so how many white cells per cubic millimeter you have. That's also important because it's part of the immune system and it helps us fight off bacteria and disease. And the last one there, white blood cell differential. So when we talked about the leukocytes, the white blood cells, remember they had all those little components, the neutrophils, the monocytes, the eosinophils, the lymphocytes. So what they do is they take the count and find out exactly how many of each are making up all of your white blood cells. So that's that one. Any questions on that? We're almost done. Clinical procedures. I think somebody already mentioned this one. Apheresis means to remove. So it's the separation of blood into component parts and removal of a selected part of the blood. Blood transfusion. That's where whole blood or cells are taken from a donor and infused into a patient. Bone marrow biopsy. microscopic examination of a core of bone marrow removed with a needle. Yeah. Okay. And the last one, hematopoietic stem cell transplantation. There's a mouthful. Peripheral stem cells from a compatible donor administered into a recipient. And I think that's on page 524, and that goes into a lot more detail. Okay, guys, well, thank you so much for being part of my lesson tonight. Any questions or comments? No, you're good?
No.
Oh, yeah.
Awesome. Perfect. Well, you did awesome on your research. And I've got a small little Kahoot game I'd like to close out with. So I will show you the password for that. And remember, next class, we're doing the lymphatic system. So just so you know and are prepared for that. Let me, oops, go to my Kahoot game that I prepared. It's 4 questions. It's nothing too complex, but it's, hold on. No, wrong. I want to play. Play. Okay. So everybody's logged into Kahoot before, right? Everyone knows how to do it. And it's going to generate a code. Okay, there's our code. I'm going to turn this down a bit. Everybody see the code okay? All right, yeah, got 1 player. Hex D. Okay, we've only got 4 players so far. I think we're missing just a few. There's 5. Globulin.
Globulin.
Okay, we're almost there. Excuse me. Okay, I think we've got 18. Oh, we got 19. I think there's what, 23 of you, maybe 22, 23. Okay, we're kind of stalled at 19. I think I'm gonna just start the game. All right, everybody ready? Oh, one person opted out. I'm losing people. Okay, I'm gonna start the game. You got to be quick on your feet. I've only got 10 seconds for each question. All right, ready? Next question. Quick. All right. Good job. Next question. Anticoagulant found in the blood. Go. Anticoagulant. Oh, here we go. There's our answers. Yay. Okay, we got 2 more. Anybody remember what those were? Globulin should get it. Yeah, everybody got it. Immunoglobulins, very good. Okay, last question. Oh, maybe that was the last question. Was that the last question already? I believe it was. Oh, no, blood protein that maintains the proper proportion and concentration of water in the blood. Go. Good job, guys. Oh, here's the podium. Yay, good job. Woo!
Congratulations.
E-Hex-D. And the winner is P. Yay! I love this game. It's so much fun. All right, guys. Again, thank you so much. On your or in your emails, I believe there's going to be a feedback form sent to you. Please feel free to give me your honest opinion and some feedback. That would be greatly appreciated. And
Put it on
yeah,
Moodle.
send it right back to my email. We'll go be good.
We put it on Moodle for you.
Perfect. Okay, guys, enjoy the rest of your evening. Thanks again. See you soon.
Thank you. Thank you, Leo.